Hello. So I did my presentation on the end of life care for people experiencing homelessness. My name is Alyssa Lee. So what is homelessness? So according to the Department of Housing and Urban Development, experiencing homelessness is defined as people lacking a fixed, regular, and adequate nighttime residence, people evidently losing their primary nighttime residence, or it could also be defined as individuals or families who are fleeing domestic violence or other dangerous conditions. So here are some statistics of people experiencing homelessness. So about 582,462 individuals are experiencing homelessness in America, and this is an increase about 2,000 people since the last complete census, which was completed in 2020. This amounts to roughly 18 out of every 10,000 people. And about 30% of people without homes are experiencing chronic patterns of homelessness. This means that they've been without homes for more than 12 months or have experienced extended periods of extended homelessness over the past 3 years. Homelessness has also impacted mostly racial, ethnic, and gender subgroups. So here are some family and cultural considerations. So there are needs concerning involvement of the family, which are different for every individual. But for some of the homeless people, they want family nearby, while others do not want to burden their families. And some may request some type of social contact with family and friends before dying, even if they are estranged. So family contact is encouraged by the health institutions, but the individuals ultimately get to make the decisions. And depending on the case, some families do reconnect with the patients, knowing the situation of the patients. So, some cultural considerations of people experiencing homelessness is that they often have substance abuse problems, high rates of mental illness and serious physical illness, lack of social support, lack of health insurance. Many of them also suffer from complex and often chronic comorbidities, and this can include things such as liver cirrhosis, cancer, and HIV. And in addition, they also die at a much younger age than the general population. Homeless people are also relatively high risk for a broad range of acute and chronic illnesses, and they also lack access to healthcare institutions and services, especially in the long years. So, social workers, doctors, and nurses meet with patients in untraditional settings, including tents, vans, and shelters. So, for social workers, they help provide emotional support, counseling, and psychotherapy to patients and their family members who experience psychological and emotional challenges. As for doctors, they will try to help diagnose and relieve pain, ease confusion, and help refer specialists and consider the emotional and spiritual needs of patients. And as for nurses, they are the main speakers to patients and will focus on communicating with patients and other healthcare workers to get the patients the resources they need. So for healthcare workers, in this situation, they would need to understand what the patients are going through, and with this, they need to help the patient to develop self-efficacy. They need to help navigate a patient to services, since it may be hard for people experiencing homelessness to actually navigate, since they may not have the tools to help them. Also supporting patients at their attendance, um, and help providing peer advocacy at appointments. Also, forming trusting relationships with practitioners and improving communication is needed within people experiencing homelessness. So, some challenges and barriers for the homeless when receiving care is accessing health services like palliative or hospice care, since they are not accessible to people who don't have a permanent home. Um, Patients also do not have support where people have the role to help care. Patients also get discriminated a lot by others to receive care. They also lack identification, lack of health insurance, lack of a phone in which to receive calls about appointment times, and also lack of transportation to make it to appointments. Patients also live far from the location of care, and patients also lack trust in health workers. There's also already a lack of hospice beds for all. There's also a lack of harm reduction approach and services. Care avoidance is also common within people experiencing homelessness due to extremely negative experiences in the healthcare system related to the stigma that patients had experienced in the past. Also, another cause for service avoidance is substance use. Not only would clients avoid services that they know they could not or would not accommodate their substance use, so substance use became a top priority for patients, superseding the potential importance of healthcare or palliative care in their minds. So there really are no places for people experiencing homelessness to receive hospice care since they cannot receive it with no permanent home or their place is uninhabitable. So patients also do not have their identification or money to pay for hospice care in hospitals. However, there are very few places that have established hospice care facilities to help the homeless. So some patients can access palliative care through shelter-based programs. This includes hostels and shelters that help coordinate with other organizations and medical staff to provide palliative care when needed, though there are limitations to what can be offered in many cases. Sometimes there are no permanent stays. There are also mobile programs. These provide shelter apps that can help patients receive nearby palliative care. However, this requires the use of phone, which many do not have. They can also help with pain and symptom management. These are local shelters that may provide daytime rest, oxygen concentrators, or secure locations to store controlled medications and other special accommodations. They may also receive painkillers such as nonsteroidal anti-inflammatory drugs or NSAID drugs and opioids. Some, but very few, may refer patients to inpatient hospital unit for very severe symptom management. For substance use and mental health, unfortunately, there are many programs that have zero tolerance policies towards illicit substances such as crack and heroin. However, there are programs to help them with substance abuse, SAMHSA programs and resources. And there's also Homeless Engagement and Response Team, also called HEART, which is our outreaching and engagement providing mental health and substance use screening. So after death, many people who experience homelessness are encouraged to reconnect with family at the end of life, where decisions can be made. However, there are many cases where people experiencing homelessness may pass away unexpectedly. So in this case, the family will be contacted, and if a family member objects to the anatomical donation but does not wish to take control of the body, the county will end up paying for the burial or cremation. And many individuals who do not have family, they are buried within 30 days by the county. Bereavement may be harder for the estranged families, especially if they have not reconnected with the patients before their passings. So there are local bereavement counselings that can help the patients' families and friends with support groups that aim in specific losses. However, as for people experiencing homelessness, they may also go to local bereavement counseling, but there's still a lot of like low turnouts because there's a lot of discrimination and stigma as barriers for people experiencing homelessness.